Good morning, respected chairperson, members of the Board of Directors, Chief Executive Officer, Senior Management Team and invited stakeholders. My name is Puvarasi and I'm presenting today as the Senior Communication Manager of our organization. Thank you for giving me this opportunity to present a communication training proposal for the board's consideration. The program I'm proposing is called the Communication Excellence Training Program for Digital Healthcare Transformation. This program is designed for a Malaysian private healthcare service organization. The main purpose of this proposal is to seek the board's approval to implement a structured communication training program for managers, team leaders, and employees. The aim of this program is to improve communication practices across all levels of the organization. The scope of this program covers four important areas. First, it will improve how managers and supervisors give instruction and communicate decision. Second, it will improve the quality of workplace meetings, including daily briefings and online coordination meetings. Third, it will be strengthen collaboration between departments such as customer service and digital support team. Fourth, it will improve digital communication practices using platforms such as email, WhatsApp Business, Microsoft Teams, and patient management system. The intended outcomes are practical and measurable. Managers should be able to give a clear, consistent, and professional instructions. Team leaders should be able to coordinate daily operation more effectively. Employees should be able to ask questions, provide updates, and communicate with colleagues and patients more confidently. This program is highly relevant in Malaysia because healthcare workplaces are often multi-language and multicultural. Based on the employee feedback, the first major issue is inconsistent instructions from management. For example, a clinic manager may instruct the front desk team to use an online appointment system, but another supervisor may still ask staff to record appointments manually. As a result, the same patient may receive different information from different staff members. This creates confusion and delays. The second issue is inactive meetings. In some departments, meetings are held regularly but without a clear agenda or clear action items. For example, a morning briefing may discuss patient flow problems, but after the meeting, nobody is clearly assigned to update the appointment schedule, inform the doctors, or brief the customer service counter. This makes the meeting less useful and waste of time. The third issue is weak collaboration between departments. In private healthcare, one patient's journey may involve registration, consultation, payment, medication, laboratory tests, and follow-up appointments. If these departments do not share information properly, the patient may need to repeat the same details many times. This reduces service quality and affects the patient's experience. The fourth issue is declining organizational productivity. When communication is unclear, staff spend extra time to correcting mistakes or handling complaints. These issues show that communication must be strengthened as part of digital transformation. This program is designed for three main groups of participants. The first group is managers. This includes branch managers, department managers, and clinic managers. Managers are included because they are responsible for setting direction and making decisions. The second group is team leaders, includes front desk supervisor, nursing, and pharmacy supervisor, and so on. Team leaders are important because they translate management instructions into daily tasks. Their main training focus will be team briefings, task coordination, conflict handling, and feedback. The third group is employees. This includes customer service staff, clinic assistant, and digital support staff. They need to understand instructions, provide updates, communication respectfully with colleagues, and respond professionally to patients. The first core module is clear instructions and message consistency. This module will train managers and team leaders to use clear, complete, and consistent messages. In the healthcare sector, one unclear instruction can create many operational problems. For example, if a manager says, "Please update the patient system later," the instruction is too vague. Staff may not know which system to update, what information to enter, who is responsible, or when the task must be completed. A clear instruction would be, "Please update the patient's appointment status in the digital appointment system before 3 p.m. today and inform the front desk supervisor once it is completed." This instruction is more effective. Participants will be trained using the 3C communication method. This means communication must be clear, concise, and complete. The second core module is effective meetings and digital briefings. In our organizations, meetings must become shorter, clear, and more useful. This module will teach participants how to prepare meetings agendas, manage time, encourage participation, record decisions, and follow up on action items. For example, the briefing should answer 4 key questions. First, what is the issue? What decision has been made? Who is responsible? When is the decline? This is very useful in a Malaysian healthcare settings. For example, if the clinic is experiencing long patient waiting times on Saturday mornings, the meeting should not only discuss the problem, it should produce a clear action plan. This module will also include digital meeting etiquette. Participants will learn how to use cameras, microphones, and meeting minutes professionally. By improving meeting communication, the organization can be reduce wasted time, improve accountability, and ensure that every meeting leads to clear action. The third core module is collaboration, feedback, and conflict prevention. In healthcare services, collaboration is critical because employees work across many departments. A patient's experience may begin with the call center, continue at the registration counter, proceed to consultation, and end up with billing or follow-up appointment scheduling. If one department fails to communicate properly, the whole patient journey may be affected. For example, if the billing team notices that the patient information is incomplete, they should not simply blame the registration team. A better communication approach would be, "We notice that some patient details are missing in the system. Can we agree on a checklist so that the registration process becomes more complete?" This type of communication reduces conflict and encourages teamwork. The fourth core module is digital communication etiquette. For digital transformation, employees must understand which digital channel is suitable for which type of communication. Not every message should be sent through WhatsApp. Choosing the wrong communication channel can create confusion and even confidentiality risk. For example, a doctor's clinic schedule change may be suitable for a WhatsApp business group or Microsoft Teams message. However, patient-related documentation should be recorded through official email or the patient management system. Staff must be reminded not to casually share patients' details in unofficial chat groups. They must use approved systems and maintain professional confidentiality. By improving digital communication etiquette, we can reduce message overload and protect the patient information. In week 1, the communication department will conduct a short communication audit using employee surveys, selected interviews, and a review of current communication practices. This will help identify the most common communication problems in each department. In week 2, managers and team leaders will attend a full-day face-to-face workshop at the main office in Kuala Lumpur. This workshop will focus on leadership, communication, message consistency, meeting management, decision communication, and feedback skills. In week 3, employees will attend a half-day hybrid training section. In week 4, all departments will apply the communication tools in their workplace and complete a post-training evaluation. The estimate budget for this program is 22,500 ringgit Malaysia. Facilitator fees Ringgit Malaysia 4,000 for training material and digital templates, 3,500 for venue setup and refreshments, 2,500 for online platform support and recording equipment, 2,000 for evaluation and reporting, 1,500 for role play materials and staff handbooks, and 1,000 for contingency. This budget is reasonable because the program supports better productivity and better patient service quality. The rollout plan will be carried out in 5 main milestones. The first milestone is needs analysis. It will help the organization understand whether the main issue are unclear instructions, poor meeting structure, weak digital communication, or lack of in-departmental collaboration. The second milestone is program customization. Training example will be adapted to our Malaysian healthcare environment. The third milestone is training delivery. Managers, team leaders, and employees will attend the relevant training section according to their roles. The fourth milestone is workplace application. Each department must apply at least 2 improvements after training. The fifth milestone is evaluation and reporting. The communication department will compare pre-training and post-training survey results. The results will be presented to senior management using graphs and charts. The key performance indicator will include improved clarity of instruction and reduced meeting time. This program is expected to create a positive impact in 3 main areas. First, it will improve staff well-being. Poor communication often causes stress because employees feel unsure, blamed, or unsupported. When instructions become clear and feedback becomes more respectful, employees can work with more confidence. Second, it will improve staff engagement. Employees are more likely to participate when they understand expectations and feel that their voices are heard. Through better meetings, active listening, and constructive feedback, staff will feel more included in decision making and problem solving. Third, it will improve productivity and service quality. When communication becomes clear, employees spend less time correcting mistakes. This can create a smoother patient experience. The program also aligns with organizational goals. As a Malaysian private healthcare organization, we aim to provide professional and digitally enabled services. In conclusion, respected members of the board, the Communication Excellence Training Program for Digital Healthcare Transformation is a timely, practical, and strategic response to the communication challenges currently affecting our organization. The program directly addresses inconsistent instructions, ineffective meetings, poor collaboration, and declining productivity. Most importantly, this program supports both organizational performance and staff well-being. It can help managers lead more clearly, team leaders coordinate more effectively, employees communicate more confidently. Most importantly, this program supports both organizational performance and staff well-being. It can help managers lead more clearly, team leaders coordinate more effectively, employees communicate more confidently, and patients receive better service. Today, I respectfully seek the board's approval to implement this 4-week training program with an estimated budget of 22,500 ringgit Malaysia. With the board's support, we can build a stronger communication culture where communication is clear, Meetings are purposeful, collaboration is stronger, and employees feel supported. Thank you for your time and consideration. I welcome any questions and feedback from the board.